The lymphatic system is our body's silent guardian. It's a network of vessels, tissues, and organs that work tirelessly to keep us healthy. This intricate system plays a crucial role in immunity, fluid balance, and waste removal. Imagine it as a complex drainage system diligently collecting excess fluid, waste, and harmful invaders from every nook and cranny of our body. At the heart of this system are lymphocytes, specialized white blood cells that act like vigilant soldiers, always on the lookout for infections and diseases. These lymphocytes travel through the lymphatic system, patrolling our bodies for any signs of trouble. They congregate in lymph nodes, small, bean-shaped organs strategically placed throughout the body. Lymphomas are a group of cancers that arise from lymphocytes. These cancers disrupt the delicate balance of the lymphatic system, throwing this intricate network into disarray. Like a weed that overtakes a garden, lymphoma cells multiply uncontrollably, crowding out healthy cells and disrupting the body's natural defenses. Lymphomas are broadly classified into two main types: Hodgkin's lymphoma and non-Hodgkin's lymphoma. This distinction is crucial as it dictates the course of diagnosis, treatment, and prognosis. Understanding the differences between these two types is paramount in providing the best possible care for patients. Hodgkin's lymphoma, named after Dr. Thomas Hodgkin, who first described it in 1832, is a type of lymphoma that often originates in the lymph nodes of the upper body. It's characterized by the presence of Reed-Sternberg cells, large, abnormal lymphocytes that serve as a hallmark of the disease. These cells are like a calling card, signaling the presence of Hodgkin's lymphoma. Symptoms of Hodgkin's lymphoma can be subtle in the early stages, often mimicking common illnesses. Swollen lymph nodes, particularly in the neck, armpits, or groin, are often the first sign. These nodes may feel painless, rubbery, and enlarged. Other symptoms include persistent fatigue, unexplained weight loss, fever, and night sweats. Diagnosis typically involves a biopsy of the affected lymph node. This procedure allows doctors to examine the tissue under a microscope, looking for the telltale Reed-Sternberg cells. Staging, a crucial step in determining the extent of the disease, helps guide treatment decisions. Fortunately, Hodgkin's lymphoma is highly treatable, even in its advanced stages. Chemotherapy, often in combination with radiation therapy, is the mainstay of treatment. These therapies work by targeting and destroying rapidly dividing cancer cells. Non-Hodgkin's lymphoma, or NHL, is an umbrella term encompassing a diverse group of lymphomas. Unlike Hodgkin's lymphoma, NHL doesn't have a single defining characteristic but rather presents with a spectrum of subtypes, each with its own behavior and prognosis. This makes NHL a more complex and challenging disease to treat. NHL can arise from either B cells or T cells, two main types of lymphocytes. B-cell lymphomas are more common, accounting for the majority of NHL cases. T-cell lymphomas, while less prevalent, can be more aggressive and difficult to treat. Symptoms of NHL can vary depending on the subtype, the location of the lymphoma, and the rate of its growth. Swollen lymph nodes, often painless, are a common finding. Other symptoms include fatigue, unexplained weight loss, fever, night sweats, and persistent itching. Diagnosing NHL involves a combination of tests including a physical exam, blood tests, imaging scans, and a biopsy of the affected tissue. Determining the specific subtype of NHL is crucial, as it guides treatment decisions and helps predict the course of the disease. Treatment for NHL varies widely, depending on the subtype, stage, and overall health of the patient. Options include watchful waiting for slow-growing lymphomas, chemotherapy, radiation therapy, targeted therapies, and immunotherapy. The fight against lymphoma is bolstered by continuous advancements in treatment, offering new hope to patients worldwide. One such breakthrough is glofitamab, a novel bispecific antibody that's demonstrating remarkable promise in clinical trials. This innovative therapy represents a significant step forward in treating aggressive forms of non-Hodgkin's lymphoma. Glofitamab is designed to simultaneously bind to two different targets, CD20, a protein found on B cells, and CD3, a protein found on T cells. This dual targeting mechanism allows glofitamab to act as a bridge, bringing T cells, the body's powerful immune cells, into close proximity with cancerous B cells. This close encounter activates the T cells, unleashing their tumor-killing potential directly onto the lymphoma cells. In a global clinical trial, glofitamab, combined with standard chemotherapy, demonstrated impressive results in patients with aggressive non-Hodgkin's lymphoma who had relapsed or were resistant to previous treatments. The trial showed a 59% remission rate, meaning nearly 2/3 of patients experienced a complete or partial disappearance of their cancer. Even more encouraging, a significant number of patients remained in remission 2 years after completing treatment, suggesting the possibility of long-term disease control or even a cure. This remarkable outcome highlights the potential of glofitamab to transform the treatment landscape for patients with aggressive lymphoma. Section 5. Zanubrutinib and combination therapies for lymphoma. The evolution of lymphoma treatment also encompasses targeted therapies like zanubrutinib, which precisely target specific molecules involved in cancer cell growth and survival. This targeted approach minimizes damage to healthy cells, reducing side effects and improving treatment outcomes. Zanubrutinib, a Bruton's tyrosine kinase or BTK inhibitor, disrupts signaling pathways crucial for B-cell lymphoma cell survival and proliferation. It's like cutting off the supply lines to a fortress, weakening the cancer from within. This targeted therapy has shown remarkable efficacy in treating mantle cell lymphoma, a rare and aggressive subtype of non-Hodgkin's lymphoma. Approved in 2019 for relapsed mantle cell lymphoma, zanubrutinib received further approval in 2024 for use in combination with obinutuzumab, also known as Gazyva, for relapsed or unresponsive follicular lymphoma. This combination therapy represents a significant advancement, offering a new treatment option for patients who haven't responded to previous therapies. Combining zanubrutinib with other targeted therapies or chemotherapy enhances its effectiveness, creating a synergistic effect that improves treatment outcomes. This approach is revolutionizing lymphoma treatment, providing patients with more personalized and effective treatment options. Section 6. Pirtobrutinib, approvals and ongoing clinical trials. The relentless pursuit of novel lymphoma treatments has led to the development of pirtobrutinib, another BTK inhibitor that's demonstrating significant promise in clinical trials. This second-generation BTK inhibitor builds upon the success of its predecessors, offering enhanced selectivity and potentially fewer side effects. Pirtobrutinib received approval in 2023 for mantle cell lymphoma and chronic lymphocytic leukemia, or small lymphocytic lymphoma, after 2 or more prior lines of therapy. This approval underscores the growing importance of targeted therapies in managing lymphoma, particularly in patients who haven't responded to or have relapsed after previous treatments. Currently, pirtobrutinib is undergoing rigorous evaluation and clinical trials for various other non-Hodgkin's lymphoma types. These trials aim to determine its safety, efficacy, and optimal dosage in different lymphoma subtypes. The results of these trials will provide valuable insights into the potential of pirtobrutinib to expand treatment options for a wider range of lymphoma patients. The development and ongoing clinical trials of pirtobrutinib highlight the dynamic nature of lymphoma research and the unwavering commitment to finding more effective and targeted therapies for patients in need.